Virus, and I don't know how much you know about HIV, but it's a bloodborne pathogen that's also infectious in other body fluids, mainly genital urinary tract secretions, but also others such as breast milk. A bunch of different ways you can get HIV. Most common is high-risk sexual behavior, so homosexual or bisexual intercourse, heterosexual contact with high-risk partners, multiple sexual partners, people who have STDs, or if you have other STDs, that increases the transmission of HIV sexually. So because it's bloodborne, you can also get it through intravenous drug use if you share needles. Blood transfusion used to be a major way that HIV was spread, and years ago, one population we lost almost everyone from was the hemophiliac population. Now the blood supply is very safe, and really haven't seen many transfusion-associated cases in the past several years. There's also been a big decrease in perinatal exposure, so children, when they're exposed to blood during the birth process, can get infected. Some also get infected in utero, and again, postnatally, there can be infection through breast milk, which is a big problem in the developing world. Since most people have had sex once, who should be tested for HIV and who is really at risk? The CDC says everyone. So anyone who contacts the healthcare system should be tested. Now, why are they taking that approach? Right now, one of the problems in the United States is cases continue to increase, but there's 25% of people out there who have HIV infection who don't know it. That's important for a couple reasons. One is they often present too late for adequate therapy, and also they're out there spreading the disease without knowing it. So when you get HIV infection, why do we see the syndrome we see? One of the target cells for this particular virus is a particular immune effector cell, the CD4 T cell. We really can't get into immunology tonight, but that's a critical cell for immune responses to a number of different pathogens, particularly ones that are intracellular, so viruses, mycobacteria like tuberculosis. And it's not only a loss of these cells through the infection or death of uninfected cells, you also lose the function of these cells. And sometimes you lose the function even before the counts go down. Now there are a number of other immune defects, but again tonight that's not really the focus. But it's just important to know because HIV is the cause of the acquired immune deficiency syndrome, AIDS, and what is AIDS characterized by? It is characterized by these opportunistic infections that become more and more common as your circulating CD4 count drops. Early on, you can have some constitutional symptoms. You might get some early mucosal infections like yeast infections in the mouth, genital tract. But when your CD4 count hits 200, you start to get really unusual infections that you almost never see, with the exception of organ transplantation and some of the primary immune deficiency syndromes. And the lower your CD4 count drops, the greater the risk of these infections, and the variety of infections really increases. So when you have moderate immune suppression, you may see things like yeast infection in the mouth, on the tongue. As the immune deficiency gets worse, you start to see things that are even more serious, more life-threatening, unusual pneumonias with unusual pathogens like one parasite, Pneumocystis carinii. As your CD4 counts drop down, you can get parasitic brain infections. So this is a CAT scan from a patient with toxoplasma encephalitis, large mass lesions that can have devastating effects. With even lower CD4 counts, infections with certain viruses like cytomegalovirus, and when you get cytomegalovirus in HIV infection, it's usually retinitis, which can be a sight-threatening and also life-threatening infection. Normally your whole retina looks like this, but with the infection you start to get this white exudate with hemorrhage and almost only seen with advanced HIV. It isn't just opportunistic infections, there are also some AIDS-defining cancers. This is a patient of ours who has Kaposi sarcoma, a soft tissue tumor. And this is something that's extremely rare otherwise, but became more common with the onset of HIV, the epidemic that we've been seeing. Globally, this is really a big problem. There's approximately 40 million people who are infected and living with HIV right now. There have been 25 million deaths so far. Always in the news is the difficulty that sub-Saharan Africa is having, but there are many hotspots in the world. And it is important that we focus on those particular areas. But the part I'd like to talk about tonight is not just the fact there have been 25 million deaths and 40 million people affected worldwide. That is important, and it's important that we start to treat those groups too. It's still less than 10% of people in the world who need therapy for HIV infection are getting it. This has been ramping up a lot lately. A while back there was this program, they wanted to get 3 million people on therapy worldwide by 2005. And they didn't quite make that deadline. It took a little longer to ramp up, but there are many, many programs out there now that are bringing needed therapy to the patients that need it. Now in the United States, we've really had great progress, and we're going to go through some of the things that have occurred with the treatment of HIV. And many people now feel that HIV is not the ultimately fatal disease it used to be. It's going to be considered more of a chronic, manageable disease that shouldn't really shorten your life expectancy. And while that may be true for a lot of people, there are certain populations that really haven't seen all the benefits of antiretroviral therapy. This is true of a number of different minority populations, but it's probably the biggest problem for African American populations. And there's some data that suggests they really sort of have the same type of outlook still as patients who are in developing countries. So over time, the number of cases of AIDS, advanced HIV, opportunistic infections, or other AIDS-defining conditions has really declined for Caucasians and whites, but it's continued to increase for African Americans. It's also been increasing for Hispanics. African Americans only account for 13% of the U.S. population, yet they almost account for half the cases of AIDS. And that's true for men, but the difference is even more remarkable for women. And the single most rapidly growing demographic is African American women right now. Now, we have made a lot of progress, and this is actually a slide from a study published at Northwestern. Frank Palella, they call it the Palellogram. And basically it shows that starting in 1996, we started to see deaths from HIV really decrease once we had these HART regimens, highly active antiretroviral therapy regimens consisting of multiple drugs that were very effective in suppressing viral replication and preventing complications. That death rate has come way down, but now we're starting to see it's sort of tapering off. And there's a couple reasons for this. One is there's continuously new infections in the United States, and we're still diagnosing too many people very late in the course of their disease when they already acquire life-threatening infections or cancers, or when they get diagnosed and won't